So in my clinic, I see many patients who cannot maintain eye contact with me, all because of their acne, and I completely understand. When I was a teenager, I had awful acne to the extent where I could not maintain social connections, and all I wanted to do was hide my face. So this is what inspired me to become a dermatologist, so I can research evidence-based skincare treatment for skin conditions. Hi, my name is Dr.ErmaDerma and I'm a dermatology specialist trainee doctor in the UK. So in this video, we're going to go through acne. What is acne? What are the causes of acne? The different variations of acne, the treatments of acne, and the misconceptions of acne. So let's go. What is acne? Acne is a chronic skin condition in where your pilosebaceous unit, i.e. your hair follicle and your sebaceous gland, gets blocked with oil, dead skin cells, bacteria and dirt. And this in turn causes blackheads, whiteheads, those red inflamed spots and other blemishes. What are the causes of acne? There are causes of acne. One of them is being hormones. Yes, hormones do have a part to play in acne. So when you go through your lovely puberty stage, you're filled with a lot of hormones, particularly androgens, and these androgens can cause sebum production, which in turn block your hair follicles and in turn causes you acne. Number 2, follicular hyperkeratinization. Now this is a very fancy word of just basically abnormal shedding of your dead skin cells, which in turn plug your sebaceous gland and your hair follicle, and this in turn let spots happen. And number 3, bacteria. The common bacteria which causes acne is Propionibacterium acnes. Now this bacteria just grows and grows inside your hair follicle, which causes it to become blocked and inflamed, and this is where you can get the very inflamed acne. And there are other factors. Unfortunately, your genetics has a part to play, so you can blame your parents for this. There is diet. Diet does have an association with developing acne and the severity of acne, particularly high glycemic index foods, sugary foods such as cakes, chocolates, all those lovely treats, others like whey protein and dairy as well. But what I would advise is that not to drastically change your diet, because we need more evidence and more research on diet. But what I would suggest is to have a healthy, well-balanced diet. So stress can cause an increase in your cortisol, which can cause an increase in your sebum production, and that blocks your hair follicle, and that causes acne as well. So smoking can cause acne, and smoking can cause whiteheads, blackheads, and other acne type of blemishes, and it's because of smoking causing your sebaceous gland or your sebum to become very sticky. But this still needs to be researched on why smoking causes acne. So what are the types of acne? There are 2 types of acne. There's the non-inflammatory type of acne and there's the inflammatory type of acne. The non-inflammatory type of acne consists of whiteheads and blackheads. So what are they? So blackheads are also called open comedones, and everything that is inside your hair follicle which gets exposed to air, such as any bacteria, dead skin cell, oil, this in turn oxidizes and then results in a black appearance. Whiteheads are also called closed comedones, and they're just not exposed to air, and so therefore they don't have that kind of black appearance. So they just look like white bumps onto your skin. The other is inflammatory acne. So inflammatory acne is where you get red spots on your face, and we call them papules, and they're just basically inflamed spots on your skin. Others is called pustules. Now pustules have a white center in them, and that's pus accumulating in your spot. Lovely. The other is quite severe, nodules and cysts. Now, nodules are very painful lumps which sit under your skin. These nodules can have a high likelihood of getting scarring. The other is also quite severe, cysts. Now, cysts are deep pus-filled lesions which also sit on your skin, and they have a very high likelihood of causing scarring. And we do not like scarring because scarring is very difficult to treat and sometimes can be very permanent. So the condition which I just explained is acne vulgaris, but there are many different types of acne which you may have experienced. One type is called acne fulminans. Now, acne fulminans is thankfully rare, but it's an emergency condition. It's where you get nodulocystic acne, i.e. nodules and cysts on your face or any parts of your body, but you also get very ill. So you can have fever, you can have joint pain, muscle pain, and high inflammatory count as well. You really need to see a GP or a dermatologist urgently for this, because you would need low dose steroid and ice isotretinoin. The other is nodular cystic acne, which is similar to acne fulminans, but that doesn't have the whole symptoms of joint pain, fever, and raised inflammatory count. But you would definitely need to see a dermatologist urgently because these acne lesions can cause scarring. And acne do develop due to endocrinological conditions or hormonal conditions such as polycystic ovarian syndrome or PCOS. 5 to 10% of females do have PCOS, and it is a combination of acne, weight gain, excessive body hair, menstrual irregularities. Typically, people who do have PCOS usually have acne on the lower half of their face, particularly near their jawline. Best treatments for them are hormonal treatments such as the combined oral contraceptive pill or spironolactone. The other is a rare condition called congenital adrenal hyperplasia, and this is basically where your adrenal gland, which sits on top of your kidneys, just expands and starts secreting hormones, which in turn causes more acne. Acne mechanica. So you may have experienced this during the pandemic where hopefully you were wearing masks. Unfortunately, when you do wear masks or even clothing which causes friction on your skin, this can rub on your skin and can cause spots. So clothing such as tops with collars, bras, that can occlude your hair follicles and cause acne. Also, any lifestyle such as sitting on chairs quite a lot. Unfortunately, if you do sit on chairs and it's rubbing on your skin, you may develop butt acne. And habits such as rubbing your face, unfortunately, since you're constantly causing friction and pressure on your face, as well as introducing bacteria and dirt, this can block your hair follicles and can cause acne. And of course, drugs can cause acne, such as taking steroids. If you are thinking of bodybuilding and taking steroids, just be aware that you may get acne, although I would not recommend you taking steroids for bodybuilding. So we went over what causes acne, what is acne, and all the different types of acne. But why do we need to treat acne? The main reason why us dermatologists treat acne is because acne can cause scarring and hyperpigmentation. This unfortunately can be quite permanent, and it can be very difficult to treat or to get back to your normal skin before the scarring. Also, acne can cause so much psychological distress and can cause low self-confidence in people, and this is what we would like to avoid. We would like to get your self-confidence back. The third reason is acne is painful. It can be very painful in some people, especially with nodular cystic acne. And obviously, as doctors and dermatologists, we want to relieve your pain. Let's get to the meat of the subject. So how do I treat my acne? There are multiple treatments for acne, but it really depends on how severe your acne is. Acne can be differentiated into the mild to moderate type or the moderate to severe type according to our guidelines. Mild acne is any number of non-inflammatory acne up to 34 inflammatory lesions such as the red spots or the pustules that you have, and up to 2 nodules. So moderate to severe acne is composed of up to or over 35 inflammatory lesions and at least 3 or more nodules. But honestly, we don't really abide by this. If you do have less inflammatory spots but is causing you scarring and hyperpigmentation, we'll probably ramp up your treatment. For mild acne, one of the first steps that you can do to help your acne is to use over-the-counter treatments. Now, I understand there are so many creams out there and skincare products all claiming that it will magically zap your acne out of existence. But I'm here to tell you what products actually work and which products and ingredients that you should look out for that could actually make a good difference in your skin. One of them is benzoyl peroxide. So benzoyl peroxide is an anti-inflammatory, it's antibacterial. When benzoyl peroxide is applied on your skin, it works in several ways. It penetrates into the skin and helps kill the bacteria that contribute to acne breakouts. Additionally, helps to unclog pores and dead skin cells, which can help prevent new acne lesions forming. Benzoyl peroxide has a mild exfoliation properties, so promotes the shedding of dead skin cells. So benzoyl peroxide is found in many different formulations such as cream, lotions and cleansers. However, there are some side effects to benzoyl peroxide such as peeling. It can be irritating on the skin. If you're using a cream and you're sleeping with that cream of benzoyl peroxide, it can actually bleach your bed sheets and your clothing. If you do go out in the shops, make sure you do look for ingredients of benzoyl peroxide. One product that you can find in shops is called Acne 5%. So you can find this in Boots or any other chemist shops or even in superstores as well. The other is salicylic acid. Salicylic acid is something which I love using. Salicylic acid is a beta hydroxy acid. It has anti-inflammatory properties. Fun fact, it's actually found in a willow bark tree, although it can be synthetically produced in labs. So don't go rubbing willow bark trees on your face, please. So how does salicylic acid work? Salicylic acid works by actually going into your pores and just unclogging all that dead skin cells, bacteria and oil. Salicylic acid, by doing this, actually improves the texture of your overall skin, and this has like an exfoliating effect. Apart from the exfoliating effect, salicylic acid reduces redness and swelling, so it does have an anti-inflammatory effect, and it's found in cleansers, in lotions, in creams as well. However, it does have side effects such as causing you redness on your skin. It can sometimes cause irritation and peeling of your skin. Some over-the-counter examples that you can find salicylic acid in is CeraVe face cleanser. This is excellent to use. Make sure if you do use a face cleanser to apply the face cleanser on your skin for around 3 to 5 minutes before you wash it off. La Roche-Posay Effaclar Duo also has salicylic acid. Don't worry, I'll write all the creams down below so you can check them out if you wish to. If you do have moderate acne, what I would suggest is that you definitely go to your GP or a dermatologist, because then we get into the realm of prescription topical treatment. Some prescription medications that you may need is topical retinoids such as adapalene or tretinoin. Retinoids are often prescribed for treatment for acne because it has an anti-inflammatory effect. It helps unclog pores, reduce inflammation, and inhibit the growth of acne forming bacteria. However, there are side effects with topical retinoids. You can't be pregnant whilst using topical retinoids because there's a fear that it will harm the unborn baby. The other is it can cause dryness, peeling, and irritation of your skin. So just be aware of that. If you are a person with skin of color and you're using topical retinoids, I would suggest to use the lower strength first and then build the strength slowly, because you do not want irritation, because unfortunately if you do have that, it can actually cause hyperpigmentation. The other is azelaic acid. Now, as doctors, we prescribe azelaic acid in the 15% to 20% range. I know you're probably saying that, well, there's azelaic acid I can buy over the counter. Those are more of the lower concentration of 10%. There's more studies done on azelaic acid and 15% to 20% when treating acne. It's actually really good for helping with hyperpigmentation as well. So this is really good if you're getting post-inflammatory hyperpigmentation with your acne. And of course, we prescribe topical antibiotics to help reduce the bacteria forming acne. By topical antibiotics targeting bacteria, it can help reduce the amount of inflammatory acne that you can have. So as dermatologists and doctors, we love combining treatment. One cream is called Epigeo, where we get adapalene, which is a topical retinoid, with benzoyl peroxide, and this is what we call Epigeo. The other is topical tretinoin, which is a retinoid, with topical antibiotic clindamycin, and this is what we call Tretlin. The other is topical benzoyl peroxide with a topical antibiotic, topical clindamycin, and this is what we call Duac. If those topical prescription creams are not helping you, the next step would be the oral treatment, and one treatment is oral antibiotics. Antibiotics reduces the bacteria forming acne, and this in turn reduces the inflammation of the acne. Unfortunately, there are side effects with the antibiotics. We do not want to use them long term because we're just worried about bacterial resistance. And because we're in a world of limited antibiotics, we really do not want you to have antibiotic resistance. The other is nausea, diarrhea, photosensitivity. Basically, when you go out to the sun, you may burn like a vampire. We do not want that. Other oral treatments are hormonal treatments, such as a combined oral contraceptive pill and spironolactone. Now, these are great for patients who have hormonal type of acne, such as patients with polycystic ovarian syndrome. If you do suffer from moderate or severe acne, the best of the best treatment that we can give is oral isotretinoin. Now, oral isotretinoin is great for acne because if you do take it, it could potentially save you from having acne in the future, so potentially can cure you from acne. There are some people who do relapse, but those are the minority. How does oral isotretinoin work and what is it? Oral isotretinoin is basically a vitamin A derivative. It's basically the oral treatment of your topical retinoid. So isotretinoin works by reducing the oil, the sebum production that helps clog pores and contribute to acne formation. It also has anti-inflammatory properties that help reduce swelling and redness associated with acne. This medication is typically prescribed for people who do suffer from nodular cystic acne or acne that is causing significant scarring and hyperpigmentation. The treatment course can vary. Some people are on it for 6 months or 15 to 20 weeks. Some people are on it for longer depending on how they respond to isotretinoin. However, there are side effects with isotretinoin such as dry skin, peeling of your skin, dry eyes, chapped lips. It can also cause a derangement of your liver and your cholesterol level. So before we start you on isotretinoin, we need to check your cholesterol and your liver blood test. And after, when you have isotretinoin, we need to check how your liver and your cholesterol is doing by doing some blood tests as well. The other main side effect of isotretinoin is that it is extremely teratogenic. What that means is that it's extremely harmful to your unborn baby. With oral isotretinoin, if there is any female who is in the childbearing age, we will need to do a pregnancy test every time they come into clinic for a new isotretinoin prescription. The other side effect of isotretinoin is low mood and suicidal thoughts. This is extremely rare, so do not get put off by isotretinoin if you are thinking of taking it. If you are taking isotretinoin and you're having low mood or suicidal thoughts, definitely do get in touch with your GP or your dermatologist urgently. Stop taking isotretinoin. If your suicidal thoughts is getting worse, then definitely go to A&E and get urgent help. And if you can't take any creams or medication, or you're allergic or there's some contraindications, whatever reason, the other option would be having phototherapy or photodynamic therapy, which is basically where you get given a medication or a cream to make you more susceptible to light, and then we put you in a lamp to help with your acne. So those are all the treatments of acne. What lifestyle factors can you do to help with your acne? The first thing that you could do if you are smoking, to stop smoking. That should really help your acne. I know there is not that much evidence on diet with acne, but it should help with other contribution to your health as well. Exercise is also great in helping clearing your skin. What skincare routine should you do for your acne? I would suggest for your skincare to keep it minimal, to keep it basic. If you are using any skin actives, or if you're using any topical treatment or oral medication, then use a gentle cleanser. So Cetaphil gentle cleanser is a great one, as well as CeraVe gentle cleansers. So use anything which has gentle cleansers which has no actives. Of course, if you're not using any actives or any topical treatment or any oral treatment, then you can use a salicylic acid. If you are using salicylic acid based cleansers, then I would suggest not to use any other actives alongside with this, or if you're taking oral medications for your acne, since this is really going to irritate your skin. If you do have acne, yes, you can moisturize. So I would suggest moisturizing this, especially if you're using topical treatment for your acne or oral medications, since this is really going to dry out your skin. Use moisturizers which say it's non-comedogenic, so it shouldn't block your pores. Also, Vaseline is completely fine to use on your skin if you have acne. It should not cause you any further breakouts. If you have milia, just be wary of using Vaseline. Of course, wear sunscreen. Definitely wear sunscreen if you have acne. This can reduce your chance of getting post-inflammatory hyperpigmentation, but also some of these medication can make you more sensitive to sunlight. So sunscreen should help stop that. What are the common misconceptions of acne? The first common misconception is acne is caused by dirty skin and poor hygiene. Complete lie, because most of the biological reactions of your acne happens underneath the surface of the skin, and it's because of your sebum production and your inflammation which is happening inside your hair follicle, and it's not because of dirt of your skin. In fact, no amount of face washing will help clear your acne. Washing your face more than twice a day can actually aggravate your skin and can make the inflammation worse. The second misconception, squeezing blackheads, whiteheads, and spots is the best way to get rid of acne. No, do not squeeze your spots, do not squeeze your whiteheads or blackheads. It can actually lead to scarring, and scarring is so much more difficult to treat than acne. Sexual activity can influence acne. No, this is a complete lie. There is no evidence of sexual activity actually having an effect on your acne. Sunbathing, sunbeds, sun lamps can actually make your acne better. There's no conclusive evidence that sunbeds and sunbathing sunbathing can actually make your acne better. I know we do have a treatment of photodynamic therapy, but this is targeted treatment for your acne. But I would not suggest on going on a sunbed because this increases your chance of getting skin cancer. Acne is infectious. No, acne is not infectious at all. You cannot pass acne to any other person. Toothpaste can help clear acne. No, toothpaste can't dry up your spot. Toothpaste does have antibacterial substances. It also contains substances that can actually irritate and damage your skin as well. Do not use toothpaste. Instead, what I do recommend is go to a GP or a dermatologist to get acne treated. And that is it. I know this is such a long video. This is my first time making a YouTube video, but I think acne deserves a YouTube featured long film. So remember, acne is frustrating, but you're not alone in the journey. There are many people suffering from acne, but by knowing what you have, the causes of your acne, and also what treatment options there are, and most importantly, who to go for advice with your acne, you're on the best route of getting clearer skin. If you found this video helpful, then don't forget to do a thumbs up and subscribe to my channel because there's going to be more skin related information if you would like them. Thank you for watching.